Dr. Geetha Jayaram is the district governor for District 7626 for this Rotary year, a past Rotaractor and recipient of a 2005-2006 Rotary grant for university teachers. She is a professor of psychiatry at the Johns Hopkins Schools of Medicine, Public Health, and Nursing. In 1997, from the Rotary Clubs of Columbia and Howard West, Dr. Geetha founded the Manasi Clinic in, and excuse my pronunciation, the Mugalur, Karnataka in India. She has volunteered for National Immunization Days for eradicating polio in India several times. She started 2 Rotaract clubs and her current Rotary Club of Howard West, increased membership in Rotary, taught as facilitator for Rotary Leadership Institute, lectured at many Rotary District conferences and zone institutes throughout North America, Asia, and Europe. She has produced at least 20 grants for domestic and international Rotary work amounting to several $million. Without further ado, our district governor, Dr. Geetha Jayaram.
Thank you, Marilyn. Thank you. Now, before I talk about my plans, which I was asked to share, I usually give like a club report, and I want you to bear with me while I walk you through your own club report. But number one, you are a vital, vibrant club in the district. It is remarkable how much you do. The fact that you have a huge foundation certainly helps all your aspirations, but you execute that with just great aplomb, and we congratulate you for that. You are one of the largest clubs in the district. You were founded in 1912. You're one of the longest. You probably were the first club established in this district. And, you know, after you established your foundation, and many people left money to your foundation, knowing how well you use your money is a tribute to the character of this club. You are also a club with a great age spread. That's something you need to pat yourself on the back for. You have 52 males, 39 females. I want to get the number of the females up more. Some of the things you've done that are in keeping with Rotary and district goals are providing scholarships, meals for the homeless, meals for the hungry, trees for the capital, and helping your immediate community in many, many ways, too many for me to even describe. You do the dictionary project, which was first established by Race Tribe a long time ago. That's something that people have still, you know, felt a great deal of need for and continue to do. And, you know, because of your actual location and your primary networking in DC, your embassy and international relations, no other club has, which is phenomenal. Your community service grants cover over 175,000, which is unbelievable. Yes, Marilyn has reminded me more than once, that's more than the district is able to give out, and that's the truth. But we are trying to increase the amount given out by the district because we started a legacy fund for the district that people have begun adding to, and that will grow in the years to come. Your International Service Committee and new Peace Working Group are very instrumental in doing much of the work for the district. And there are other things that make you stand out, like the Walter Reed Bingo, the fact that your club often sponsors, you know, international and global scholars, and the fact that you have numerous outstanding club members. And forgive me if I miss anyone, you know, May and Mimi work on our grants committee. That's a lot of work. Marilyn has done a remarkable job of RILA in the past. I mean, for somebody so young, she is extraordinarily energetic and productive and is an emerging leader in the district. Maria Nelly Pavicic, who's at the National Museum and Center for Service. Nancy Riker, who's your immediate past president. Steve Liston, who's the chair of the Embassy and International Relations Committee. Sam Hancock. I mean, the list goes on and on. You have people who represent the district with great dignity and service-mindedness, and for that, I thank you. when we look at the club recognition points, your current number of points is 51,000 plus points. And I'll come back to that in a minute. You have 17 Paul Harris Fellows that are new since the 1st of 2021. You have 16 multiple Paul Harris Fellows. You have 20 Paul Harris Society members. You have major donor status with many club members at several levels. You have 24 benefactors, and you have bequest level 6 members. Is Susan O'Neill here? No, I mean,
No, she lives in Mexico, but
okay,
we're always in touch with her.
Okay, Susan has made a remarkable contribution. I just want you to give her a huge round of applause. Her contributions range somewhere between $500,000 to $1 million. That's incredible. There is probably only one other person in that status in the district. You have one, Arch Clump Society couple. You have several Bequest Society members. You have a range of Bequest Society from level 1 to level 4. All of that, as Rich pointed out during our celebration gala, all of that goes towards a profile of the district in terms of giving. So I thank you very much for what you do. Bill asked me to talk about what exactly we should be doing given your location and your club standing strong for ties to the international community. And that's something really, I can tell you a whole bunch, but that's something I believe you all should think about. So let me tell you a little bit about my experience, and then maybe from there, some of the ideas for international work and cooperation will come about. So I grew up in a Rotary family. My father was a Rotarian, 2 of my brothers were Rotarians. We experienced living in well-to-do homes while there was dire poverty all around us. So we actually saw how people lived on maybe 1 meal a day, absolutely no roof over their heads, just maybe an asbestos sheet or a piece of tarpaulin on the sidewalk being somebody's home. We saw children who played in the mud with hardly any clothes on. They had to go from place to place wherever their parents moved because they lived in slums. The idea that people who are in need, not just for their basic living, but for their basic meals, for their basic day-to-day amenities, was something that was drilled into us a long time ago when we were young. So that stayed with us throughout our lives. So we grew up understanding that before we celebrate what we had to give to people who were way, way less fortunate than we were. Now that trend continued with us through our teenage years when I became a Rotaractor. And then as a medical student and as a resident, part of my life is giving. That's part of my profession. So I married my Rotary goals with my life goals of being a physician and a community psychiatrist. When you are a community psychiatrist, you work with the poorest of the poor, and I chose to work with the inner city poor in Baltimore. And since then, I have worked with the poor in many countries. Now, David Klaus was the chair of the committee that interviewed me for the University Teachers Grant, and he will tell you what exactly he asked me, but thank you, David, for choosing me for that grant. That enabled us to launch a series of grants in terms of matching grants, discovery grants. These are now archived, they're gone, you don't have them anymore, but they've served a purpose, a string of Rotary grants in terms of doing work. What started my work in India was a question the chairman of the department asked me when I interviewed for my residency at Hopkins. He said to me, Dr. Jayaram, if people like you leave your country, what happens to your country? Now that question haunted me for a long time until I joined a Rotary Club. Believe me, it was not easy. And any woman here will understand what this means. So I tried 3 times to get into a Rotary Club in Colombia, and I was told, just get lost, because if you come, the guys will leave and we can't take women. So finally, they admitted me in 96 to the Rotary Club. And in 97, I started my project. The project was located in absolutely rural areas where there was absolutely no access to care at all. The roads were impenetrable. There was sometimes very difficult access to any kind of care because of monsoon rains that would destroy any pathways to the villages. There were no buses, no cars could go into those roads. So you understand that the need was acute and the scarcity of care was not just for mental health care, but for any medical care at all. When I went to look at the village of Mugalur, the idea was to establish an integrated care program, which was dovetailed into primary care, because primary care is established throughout India in villages. It made sense to have care integrated because the villagers could hardly go to 5 or 6 different places for 6 different needs. They usually go to just one clinic. So that was started formally in 2002, but it took a cooperative agreement and effort of 3 entities. One is my Rotary Club, another Rotary Club in India, and a medical school that was local that delivered the care. Now, we did it in a way that is not duplicated, as far as I know, in any transatlantic global grant. We had research teaching as well as patient care and treatment. So the issue was, we did a good job because we did an epidemiologic survey of 17,000 households, all done for free, something that would cost millions in the US. So the clinic was established. Our backbone for that clinic was 4 women caseworkers who lived in the villages, who were trained, who were educated, who were high school educated, but could understand what we were teaching them and learned very well how to screen for common medical and mental disorders in the surrounding villages. They are enormously successful because of the culture where the women can walk into the homes fairly freely and do outreach and get the cooperation of the women residents. They began teaching in women's cooperatives. They taught in local high schools. They taught in elementary schools. They did focus groups. I mean, it was incredible how much work they did. Yes, they're supervised by a number of physicians, residents, and medical students. And we've taught hundreds of students and nurses in that program. Now, what started as an effort to help just 15 to 17 villages just morphed into something so large, we never even expected we would be this successful. So word got out, the villagers talked to one another. Everybody understood if they came to this particular clinic, they would get the best care. Now, there has been, due to Rotary efforts, project upon project upon project within that one area. So we have vision care, we have hearing care, we have rehabilitation, we have elder care. I mean, the list goes on and on. We've created a lab for services. We've given an EKG machine. We have computers given. And I can go on and on about everything that we've done. It's an incredible amount for low cost. So the total cost of delivery of care and everything else we're doing was about $38,000 a year. But then we had even a bigger ambition after that. We said, we're going to create software because, Bangalore, where this is located, is an IT capital of Southern India. So we began doing what we call, a cloud-based database. Instead of handwriting it in paper and pencil, all of our information was moved to a cloud-based database that the caseworkers were trained to put data into. So the caseworkers carry handheld Samsung 7 computers where they go to their homes, they input the data, and the database is a research-ready database. It has tools that are used all over the world for assessing patients, and where the WHO uses certain tools, we've incorporated them. I mean, it's really an extraordinary job of several years of effort. We believe this should be the kind of database established for low and middle income countries all over the world. And that's point number 1 for your club. How do we do international work? We should disseminate work that's already done without duplicating our efforts all over the world. So this software will assess outcomes, will assess, what are the transportation needs, will assess, standard of living, a number of other things. I mean, I could go on and on, but I want you to know that it is applicable. That software will be made available by us as Rotarians. We're going to donate it to any low and middle income country that wants to use it so that they don't have to duplicate our efforts. It has taken us a long time and lots of minds to create this database. Now, this kind of effort, because I was asked, we've duplicated in Lithuania, and I'm now doing it in Kenya, for which we got global grants. The point is this: when people saw the success of our effort in southern India, it spread not just to a few villages. We draw patients from 212 villages. That's an extraordinary effort. And that is because it's successful. People see everyone gets better. People see we restore them to full function. And we also empower the women in the villages to derive an income. To give you an example, there was one woman who was treated for depression. She had a high school education. She wanted to go and learn to be a seamstress. We paid for that. She became a tailor. She then set up a tailoring school for the village women. So many of the women now learn how to do their own blouses and so on, and they can sell them or they can earn a living by doing this. So I beat the bushes to get some donated Singer machines. I harassed Singer here. I harassed Singer in India. Finally, some Rotarian said, I can't stand to see the kind of effort you're making. I'm going to donate 8 machines. So we have a tailoring school. The 8 Singer machines are donated. Like that, the Rotarians who worked with me were just so phenomenal in India. It has been a pleasure working with them. In Lithuania, we brought down the rates of suicide in 14 districts where the rates were 4 times that of the United States in young persons aged 14 to 24. Lithuania called me to help them out. It took us about 2 years, but we did the work. They filed a report last year. It was incredible how much work was done by the entire community. So when you ask about, an international community and a networking effort, they made an effort to network with Scandinavian countries, with the Netherlands. They made an effort to network with their mayors, their law enforcement officers, people in the community, the Vilnius University School of Public Health. I have never seen such a concerted effort made by one country to help their young people. It was incredible. Now, that effort can happen if you have people who are effective leaders in the community. Imagine your club could absolutely transform the DC area if you so intended. You can do it, but you've got to set your goals high and not say, how do we get together for parties and work together? Hey, people come for parties. Why can't you get together to do the work? It's possible to do. Now, in Kenya, which is a lot more difficult for us because they have pit latrines, they really don't have very good water and sanitation, and they have mud huts with no, windows, doors, nothing. It's incredibly difficult because they're even possibly 50 years behind India. So it's hard and it's going to be difficult, and we still have many obstacles to overcome. But overcoming obstacles is part of what Rotarians do fabulously well. You, in your club, have some of the best minds, not just in the nation, but probably in the world. Use those minds to do something remarkable and phenomenal, which you are capable of. You also have a lot of young people who are highly trained, highly educated, and are multicultural. I mean, your club is a star that can be used to galvanize the entire Washington area. And that's what I'm saying you should be doing. So when I said, what's part of my strategic plan? My concern was for the women. Every country I have worked in, I've worked in now 4 continents, every place I've worked in, it is the women that bear the brunt of what's going on in that family. They have to make sure the children are safe. They're the ones who take them for their vaccinations. They're the ones who have to really care for the elderly in their homes, with the result that they are often held back and they cannot fulfill their ambitions because their primary job is to make sure the family hangs together. Now, they also often in poor countries are given away in marriage in their teenage years. Now, I'll tell you what a heartbreaking story it was for me to see a child, a little girl child of 9 in Kenya, pregnant, people. Can you imagine? She's just a baby. And this girl was pregnant and had to come to deliver. The perinatal mortality with that kind of cultural tradition is enormous. Now, in India, we have set people back 10 years at least during COVID because child marriages have gone sky high again. They are back to giving away these 14-year-olds in marriage to someone who's 50 years old because they can't manage. They don't have money. They can't feed their children. So the girl children are often exploited and given away. Now, if you saw that plight, trust me, you will want to double the women in Rotary, and I'll come back to you with a plan on that. So the first plan was to really do stuff for women and children via grants and in any other means. And we've indeed given away a lot of our grant money to support women and children. The second issue really is membership. And membership across the world is only 23% women in Rotary as compared to men. 23% is not enough. We should have at least 50%, and we don't have that. And here's what happened in the Council on Relations just recently, the legal process of voting for women, there was a move to having women be at least, just listen to this, 30% of the Board of Trustees. It got voted down. We asked for only 30%. It got voted down. I mean, that's a shame. Imagine how many of the women in your club do an extraordinary amount of work, okay? I mean, there's Jennifer Hara, there's Marilyn, I mean, look, and Muriel, and, you know, May O'Brien and Nancy. I mean, imagine how many of you do an extraordinary amount of work. If you doubled the number of these women, you would double the number of things that you do. So my concern is that they're not always recognized, they're not always promoted, and we forget to ask. 82% of the time, people join because some Rotarian asked them to join. How often do you see a stellar person in your community that you think has the mind and heart of Rotary, but you never say to them, hey, I'd love for you to join my club? That's the second M. So my 4M plan was mothers and children. Membership is the second one. The third has to do with marketing. I know you guys do a great job. Your website is bold, it's vibrant, it's engaging. Not every club has that. So if there's one thing you all can do, you can really help other clubs duplicate what you've done. Your list of speakers is phenomenal. Share your speaker list with some of the other clubs. They don't always have those kind of speakers in their communities. That's very important. We can all help one another. I understand that you have enough money of your own, but you know, you can also engage some other smaller clubs who cannot do it on their own in some of your projects. Try and do that. So the networking and the marketing should happen locally and should happen outside of your club. So marketing in social media, marketing in any other way, and our service projects that we're doing monthly. Shekhar Mehta just asked us to do a service project once every quarter. I said, no, we're going to do one every month. We're doing one every month. If any of you came to the gala and saw the service projects posters, you'll see how much the clubs are doing. Now, during those times, we market what we do to the public. We want to do this in a very highly visible area, network with other nonprofits in the community, and that then you will be seen. Now, we have on our website materials or resources for doing this. Marilyn knows what they are. You can use the resources freely to develop flyers, to develop business cards. We have a vanity number 1866 Go Rotary. There's a QR code on the business cards. All people have to do is scan it and they come directly to our district website. These are steps we have taken to move forward. We also have a marketing committee. We're trying very hard to find ways to market our efforts. So it's not enough to just put it in our newsletter, which is internally available. What you're doing, put the stuff you're putting on in the newsletter out to the public in some manner. And we're doing that. We advertised in the Beacon, which is an over 50 newsletter. We also have our social media presence, but I would be very happy if somebody in your club knows how to do the social media postings and wants to do a blog post, let me know. I mean, it can be a Rotaractor. I will be very happy to use their efforts to do that. The last M has to do with modernizing Rotary. We had, and Marilyn has helped this group. It's Rotaractors supervising interactors who will put their innovative ideas or transformational ideas on a platform called Slack. They are currently working on developing an app for interactors that goes on your cell phone that tells them about service projects all over the district. I know that their aim was much bigger, but I think they should start small. And I've appointed a couple of people in the district who are aware of how to develop apps who are helping them. If it doesn't get completed this year, Marilyn, we'll roll it over into the next year. There's no deadline. The idea is that we hear from our young people how we should be communicating, how we should be transforming Rotary. It shouldn't be top down, it should be the bottom up. The youth should lead the way, and they should be telling us how we should reform the way we work with one another, we develop our ideas, we communicate. So that's the 4M plan. Now, what I will tell you for me, which some of you have heard me say already, so if I'm repeating myself, forgive me. For me, Rotary is all about service. For me, it's not a title. It's not some, rising like cream to the top or clawing your way up because you have the biggest dorsal fin. I couldn't care less about any of that. For me, working with the people in need directly is what really inspires me. And as I said before, when I walk into this little 8x8 room, which is somebody's house, and that person receives me with dignity and care and love and so much respect, when all we've done is give away money or help that we can easily spare, it doesn't deprive us of anything. That caring and the warmth and the respect that these people give you in the villages of Kenya, in the villages of India, it really warms your heart. It makes you feel like you're doing something important. It raises your self-esteem. It makes you grateful that you have been given the privilege of helping someone, because that is indeed a privilege that we should enjoy and we should respect. So we're not just giving something to them. We, in fact, are taking away a whole lot from a small person with a tiny house, but a great heart. And that, I will tell you, is intoxicating. When someone says to me, how come you're going back every year? We've gone back, Jay and I, who's helped me immeasurably. We go back every year and spend about a month. We've done that now for over 22 years. I'll tell you why. It's because they give me far more than I have ever given any of these people. And to see that we transform their lives and to make them better is incredible. So when we went to Kenya, 3 of my nurses from Hopkins came with me on their own dime. I didn't give them anything. I provided room and board, but they did intense work with 12 village caseworkers who, in Kenya, they speak English. So this is not hard to do. We worked very hard. And one person, my young nurse, Moses, whose parents came from Kenya, who speaks Swahili, was just so thrilled to work with me. He said, I want to come there. I want to work with you. And we did. So he went back on his own for the second time, last year, to see how maybe the work had progressed and how treatment was being handled in the clinic where we worked. So there was this man called Patrick who had a college education, but had what we labeled as schizophrenia, a psychotic illness that held him back. He was raging, he was difficult, he was violent. His family didn't know what to do. There's absolutely no care around there. You have to travel 5.5 hours to get any kind of care. So the family had him in chains. For 15 years, Patrick was in chains. So we go and we administer a medication, one medicine at bedtime, just one pill. Moses goes back. Patrick is no longer in chains. He's walking around freely in the villages. Now, Patrick also had been infested with a number of skin, infestations, diseases. He was clean. He was whole. His skin had healed. He was smiling. And Moses could see Patrick was a college-educated man with the way he conversed and the way he was walking around the village. Moses goes back. He is unbelievably blown away by the fact Patrick is now fine. And the villagers are crowding around Moses like he's some kind of miracle worker, like the real Moses. It's unbelievable. So Moses comes back to me. He says, I want to join Rotary. I want to be with you, Geetha. I want to join Rotary. And he is going to lead a team of nurses for our Kenya project because he understands what it means to transform somebody else's life with something that we absolutely take for granted in this country. So what is it about you all Rotarians who, without any knowledge, no forethought, no preconceived notions, instinctively and reflexively help others? I love the altruism that you all have. That little flame of altruism in every single one of you is a driving force for all Rotarian activities. And I want you to simply fan that flame into a huge conflagration. That will be enormous if you get more women into the club. I have plans to get 100 women members to come through in March, which is the Women's History Month. I'm telling every one of you women to have a list of the women we will get to join Rotary all in one fell swoop. I'm working on a luncheon where we will celebrate the power of women in Rotary. So when people say to me, what is this? Is it worth everything? One of the things I'd like to say is, when I leave this world, I want people to say that I made a difference. Thank you so much.
Thank you so much. Great to have you. And I'd like to open it, if I may, to questions and any comments. Please raise your hand to be recognized.
We had one question from Dr. Sam Hancock.
Yeah.
Dr. Sam, thank you, sir.
Hey, Geetha, thank you for being with us and a very inspirational talk. And also thank you for helping us to kick off the International Global Grants Projects Fair. That's going extremely well.
Yes.
I think now through Shab's effort, there's somewhere around 800 global grants that have come out of that for about 15 to 20 million US dollars. So that's working extremely well.
Yes, so
and
Sam, one of the things everyone in your club might know, but the district does not know that you have the link to, or the network or a database of global grant applicants who can join hands with people in the district. And one of the questions I think maybe Mimi or it could be Sharon Taylor had asked me is, we should put these opportunities on our district website. And we can talk offline at another time, but that's one way to get everyone involved internationally.
Yeah, and also too, we have a gentleman from Mexico who is managing that database, and that literally is refreshed every hour.
Yes.
And a lot of those global grants are being posted and being funded and submitted to RI Central in one day. That's the amazing thing about it.
It's just
one
great.
day.
Yeah. Yeah.
Anyway, my question is, how can we help you and what you're doing? Because you and I talked about this before you even took over your position. Is with the District 7620, you really want to expand the number of global grants across the district, not just our club, which does many of these. So how can our club, but how can the other clubs in the district really help you and future district governors to expand the global grants opportunity?
So the first thing is that there are only 26 clubs in the district that are MOU certified. One way to get people to apply for global grants is to first, they got to get MOU certified. Now, that's the reason why we need to increase the membership, because in many small clubs that are on an average 20 some members, it's too much work for a small club like that to be able to raise enough funds to get a global grant. So one way we're doing it is I am very strongly encouraging clubs in an area to join hands together, or even outside of their area. So for example, when we did the COVID global grant, Paul Mahara from Mount Airy and I from my club and Jay from my club, we joined hands to do it. But we actually got contributions from like 8 or 9 clubs. So they get credit for all of those, global activities, but we were able to quickly raise enough money for a global grant application that amounted to $70-some thousand. So it's possible to do if clubs join hands. It's possible to do with clubs like yours guiding people. And I believe we should have a tab on our district webpage. We're doing this slowly. I mean, I wish I could have done it faster, but I can't. We need to have a tab that says, here is the link to your global grant postings can be on our website. So people can say, I want to work with, maybe cleft palate. Who do I work with? And they can go straight to your database and figure out who they can work with. So I think the importance is joining hands and networking increases the impact, increasing membership increases the impact. But a number of people need training in how to apply for a global grant. It's not an easy process. And Rich has been conducting these sessions where people are taught how to do it, but it would be great if I think, Mimi did, and May O'Brien did a class for how to do it. Those I think should be repeated at frequent intervals, because if you don't make it to one class, the year shouldn't go by without your having done nothing if you're interested in a global grant. So those are the ways I would say we can increase our global presence.
And one thing I'll add and get off is that with the International Global Grants Projects Fair, that's the 3rd Tuesday of every month. And every one of those meetings always has training on global grants. And we actually have people that will finish their global grant application during that meeting. It lasts for about 3 hours. It's very intense, but it's like magic.
Well, Geetha, we've just about run out of time, but we have a tradition as a club, as you may have heard. We plant a tree in the honor of each of our speakers. And of course, you're a very special speaker, being our district governor. So we will do so in your honor. We have a partnership now of 30 years with the National Park Service. It started with planting 10 replacement cherry blossom trees every year near the Tidal Basin, Washington Monument. We've added an additional 35 trees, which are native trees for the retreeing of our downtown parks here in Washington.
It's beautiful. Thank you. That's so important. I heard now with the money that's come into the counties, different counties, they're actually, a lady came and talked to us from our local county, I guess, park service. She said that they will actually offer to give away native trees for free if Rotarians are willing to go pick up the trees and plant them. So that's a great thing.
Yes, and we believe in that. And actually, the chair of our Trees for the Capitol is on right now, Brian Ingram. And he and I have been working to expand the program to be Trees for the World. And we're going to do our first international tree project on a significant scale.
Wow, thank you. That's great. That's great. Once you do that, though, publicize it, send it to the Rotary magazine. I mean, you've got to publish it.
Okay, hear that, Brian? Okay.
Absolutely.
Okay, we'll make it happen. Again, it's been an honor to have you. When we
do
decide to plant that tree, we will invite you to the tree planting ceremony. By the way.
Okay, thank you very much. It's a pleasure always, as always, attending any Washington Club meeting. It's a real pleasure. Thank you.